Okay, this is the test for leg length discrepancy. Basically what we're going to do here is take a tape measure. We're going to measure someone's leg, but we need to have our landmarks in place first that we're going to measure side to side. And so if you're assuming that this person might have a leg length discrepancy, it's actually quite normal to have a slight variation in limb to limb. Same thing for wingspan. We might have some slight variations. Anything less than a centimeter we consider to be normal. If it's more than a centimeter, then we need to assess if this is from a traumatic injury, maybe to a growth plate earlier in this person's life, or if they have some sort of maladaptive bone or something like that. So, and we can treat this through orthotics and wedges and things in people's feet to see if that will improve their gait or their mechanics with movement. So basically what we do is just have the patient lay down. They're going to lay with their legs fully straight. Typically we have the shoes off. We're going to keep the shoes on for this individual just because later today with filming we're going to do some other tests. And so we're going to take our tape measure. You're going to be on the centimeter side. You're going to palpate for the ASIS at the hip. And that's where we're going to start with the 0 measurement on your tape measurer. And you're going to pin it down on the most anterior portion of the ASIS that you can find. You're going to straighten that tape measure out. Try to stick to the contours of the leg best you can, all the way down to the medial malleolus. And then you're going to palpate the most medial part of the medial malleolus. And right where that's at, we're going to try to see what the tape measure says. So this says 92.6 on the right leg, and then we would measure on the left leg, and we'll do that for sake of the video here as well. Palpate the ASIS, find that again, go all the way down to the medial malleolus, and this person's at 92.1. So 92.6 and 92.1 is half a centimeter, completely normal. If it was greater than a centimeter, we would start to consider maybe orthotics and different treatment approaches if we think that's contributory to any pain they're having.